China is calling for vigilance as the country grapples with a surge in respiratory illnesses this winter season. Health advisories have been distributed across the north of the country, warning the public to take extra precautions. The World Health Organization has reported that China did not detect any unusual or novel pathogens in infections so far. The rise in the influenza-like illness has been most prominent amongst children. A children's hospital in Beijing had told state media that it was seeing at least 7,000 patients at the facility, far exceeding its capacity. Officials had earlier blamed the spike on the lifting of COVID-19 restrictions, as well as the circulation of known pathogens. For more, CNA's Olivia Siong joins us live from Beijing. Olivia, we just heard that one hospital in Beijing saying it's seeing far more patients than it can actually cope with. But is this situation more widely spread amongst other hospitals in the north of China?
Well, Wei Su, yes, it does seem to be the case. Authorities are acknowledging that there has been a rise in the number of respiratory illnesses in recent months since mid-October, especially among children. And this comes as we have seen in social media posts and reports online of crowded hospitals and long waiting times, and parents and children. We are seeing images of them waiting to see the doctor as well. I spoke to a father of a 7-year-old son here in Beijing who said that he's brought to see his son to the hospital about 4 times in the last 3 weeks. And at one point at the emergency room of the children's department of the hospital, his queue number put him behind 600 people, and he had to wait about a day and a half before he was able to see a doctor. Also, on another occasion, he said it took him 8 days before he was able to get an appointment for a specialist to see his son. And when I asked him how he felt about this situation, he said that, this was something that they had to accept, and what he's hoping for is that his son would be able to recover quickly as well. And authorities have said that there's been a spike in these respiratory illnesses since mid-October. Chinese authorities and doctors earlier had said that this was due to an immunity gap because of the lifting of COVID-19 prevention measures, including that of mask wearing. Also, they said that there were multiple pathogens, including influenza as well as mycoplasma pneumonia, which affects children that have been circulating in the population here. Although one doctor also told me that it's not too surprising that we are seeing an increase in the number of people falling sick, given that we have now entered the cold winter months in the north of China, especially here in Beijing as well, with temperatures falling to below 0 degrees Celsius even today. Wei Su?
Olivia, essentially you're laying out what officials have said to stress that there's no need for alarm in terms of what we're seeing in the spike in cases. High incidence season, also there's an immunity gap as well. But even so, authorities not taking chances. They have distributed health advisories as well.
That's right. Today we heard from health authorities. They issued a notice today calling on all localities to prepare for what they said were going to be higher incidences of infectious diseases in the winter and spring seasons that are coming up, including that of COVID-19, influenza, and mycoplasma pneumonia. Now, this comes as the World Health Organization had asked China for more information about these cases, Beijing replying that there was no unusual or novel pathogens in the illnesses that have been spreading in northern China, including in Beijing. But with regard to the current situation, Chinese health authorities are saying that the current number of COVID-19 cases is stable, but there is a risk of a rebound in the coming months. And so it laid out measures including increasing monitoring at the ports, also strengthening prevention and control of vulnerable groups, especially the elderly and children.
Thanks for that. CNA's Olivia Siong there reporting live from Beijing.